Okay, if gender affirming surgery is for you this year, 2024, this video is for you. I want to bring up 3 things to your attention that you really need to get working on now if you want to make your surgery happen this year. So when I'm making this video, we're right at the start of July, right at the center of the year. It's not too late, but you need to get moving. So point number 1 is most of us surgeons are busiest in the second half of the year, especially those of us who work with insurance. And this is often because people have used up their deductible and now they see the end of the year looming and they want to get their surgery done because they've already eaten up that deductible, and let's try and do it this year. So my number 1 piece of advice is get that appointment as soon as possible. In my office is one of the things we really pride ourselves on. It doesn't take too long to get the appointment. The staff work very hard to get folks fitted in. So on average, when somebody reaches out to us, the time before you're able to do a consult, and usually we'll start with a virtual consult, is about 2 weeks typically. How long does it then take to get to surgery? Really depends on the type of surgery we're doing. For most surgeries, it takes anywhere, well, sometimes we can get cancellations. It can be 2 weeks to 2 months to 2 years, depending on what the patient wants. But my staff are very good. They have great flexibility and they look out for meeting your needs and getting you in as soon as possible. And that's one of the reasons I switched over to private practice, because I love efficiency. And we do certainly have that. For more involved surgeries like bottom surgeries, usually in my practice it takes about 6 months, because we're working with a hospital and we have to work with their schedule. Sometimes we're working with another surgeon as well to do peritoneal, for example, and maybe a robot. So those surgeries take me the longest. For example, peritoneal vaginoplasty, that takes about a year to schedule with me. So it really just depends on what the surgery is, but in general our wait times are not too long. But having said that, I'm already beginning to see the calendar fill out, especially for the end of the year. People love to do surgery in December or around Thanksgiving, so they can have that downtime to recover at home with friends and family or whatever it may be. And that brings me on to point number 2. If you're thinking of doing surgery, just remember you're going to need support. So what I mean by support is you're going to need your people, ideally, or you're going to need the finances. So just remember, surgery, unfortunately, it's not an exact science. With most surgeries, top surgery, you'll go back to work in about 2 weeks, but that's not necessarily guaranteed. So I always advise folks, if at all possible, even if your insurance is going to cover your surgery, surgeries are expensive. You got travel, you got deductibles, you got co-pays, and unexpected things like having to take a longer time off work, for example, having to buy different supplies for surgeries, mastectomy pillows, that sort of thing. So really have an honest conversation with yourself. Look at your finances, look at your support system. Is this year the time to do it? And especially when we're talking about bigger surgeries like vaginoplasties, a lot of patients have to take 6 weeks off in order to recover from that because they're learning how to dilate, that sort of thing. So be very honest with yourself. Is it a point in your life where you have the resources and you have the people around you to support you through this surgery? On that note, it's worth mentioning that most of my patients travel in for surgery, and it can be very difficult to find somebody who happens to be free for a week or whatever it is to travel with you, and that can be expensive too. So when you have any sort of general anesthesia, legally requires somebody with you for the first 24 hours. So a lot of our patients, we can connect them with somebody they can hire down here in Florida to help them meet that requirement and give them some support around the time of surgery. So that is an option as well. Point number 3, of course, is insurance. Does my insurance cover it? Do you accept my insurance? All that sort of thing. What I'll tell you about insurance is the patients I have who do the best and get reimbursed are the ones that are proactive. As the insurance company's client, You are empowered to do this. So the first thing I always recommend is when you're thinking about doing any sort of gender affirmation surgery is see where you stand, see what policy you currently have. So what you're going to do is get your insurance card, call the number on the back, and first question is, do I have benefits for a diagnosis of gender dysphoria? If the answer is no, well, it's kind of game over. You can't really do surgery for gender dysphoria and have it covered by your insurance. However, open enrollment for a lot of folks is in the autumn or in the fall, and that's where you may think of signing up with another policy. Or if you're with a small company, you can bring it to your employer's attention that, hey, my medical needs aren't being met here. Usually it's just an oversight, and I've seen many cases where the employer has gone on to correct it and offered a better plan to that employer. So first question is, do I have benefits for gender dysphoria? Next question is, a lot of folks have to travel and a lot of surgeons are out of network like myself, but you can still get at least reimbursed by your insurance. And so the question is, do I have out of network benefits? And then the third question is, what do I have to prove to the insurance company in order to get my surgery? Usually for top surgery, it's one letter from one mental health professional. For bottom surgery, it can be two. Sometimes we see weird requirements in there still, like you have to be on hormones for a certain amount of time. Unfortunately, we're still seeing that sort of nonsense in there. It is getting better because, of course, there's a whole cohort of patients who need top surgery and never need hormones, you know, but things are getting better from that point of view. So right now, those are three things I recommend. One, get in touch with a surgeon as soon as possible. Don't wait any longer if you want to get it done this year. Number two, look at your situation, look at your finances, look at your support group. Is this year the year to do it? And number three, call your insurance. You're entitled to this information. Find out where you stand and what requirements you need to meet. I hope this is helpful. Best of luck.